Well, welcome to the Health Freedom Conference. My name is Brian Hooker. I am a PhD biochemical engineer, and I am also a board member for Children's Health Defense and serve as one of their science advisors. And today, the title of my talk is Health Outcomes of Vaccinated versus Unvaccinated Children. This is a compilation of a study that I completed with Neil Miller that was published in the journal Sage Open Medicine in May of this year. And it's not difficult to notice or pick out, but we are surrounded in our society, especially in the United States, by sick children. And it turns out that as of about 2016, 54% of all U.S. school children had been diagnosed with some type of chronic disorder. Okay, that's a lot of children. So over half the children in the United States have some type of chronic disorder, and 1 in 6 children has been diagnosed with a neurodevelopmental disability. That would include things like autism, learning disability, speech disorder, language disorder, or ADD, ADHD. And at least 1 in 54 children, and I'd say that's a conservative estimate, at least 1 in 54 children has been diagnosed with an autism spectrum disorder. And there's been an explosive increase in these disorders since the early 1990s. Back in the 1980s, the amount of children in the United States that had some type of chronic disorder was more like 12%. Now we're at 54%. One of the big culprits, obviously, is vaccination. For a lot of you, that's why you're here. A lot of you have vaccine-injured children. Like myself, I have a vaccine-injured 22-year-old son who is profoundly disabled, got the diagnosis of autism when he was 18 months old, and then we immediately suspected the vaccines because of a reaction that he had when he was 15 months old, getting 3 different vaccines, all while having an active ear infection. Okay, now despite multiple calls to look at vaccinated versus unvaccinated populations, and specifically the long-term health effects of vaccination, the U.S. government officials refuse to do this type of study. They simply claim that the data are not available. And it's very easy to find this information, but they say that there's such a small sliver of the population that is completely unvaccinated that no such study could be done. Absolutely, positively false. Okay, even the CDC's own database, that's the Centers for Disease Control, their database is called the Vaccine Safety Data Link, and that includes unvaccinated children. I would estimate out of the 2 million children in the database, there's no less than 20,000 that are unvaccinated, and that is plenty of children to do statistics, to do a matched case control study of vaccinated versus unvaccinated children. They also claim that the only useful study would be a double-blinded placebo study where vaccines would be withheld from some children without their knowledge. Again, absolute rubbish. Okay, the gold standard for retrospective post-market surveillance done by the CDC is not a double-blinded placebo study. Double-blinded placebo studies are to get drugs approved, not for drugs that are already approved in the market. And so when you look at retrospective studies, these are completed all the time to set policy, to set vaccination schedules by the CDC and the rest of the HHS. And again, they serve as the gold standard for post-marketing surveillance. So you don't need to blind one population. There aren't children that are getting no vaccines without their knowledge and other children that are getting vaccinated without their knowledge. You simply need to look at historical data for children whose parents have chosen not to vaccinate them and those parents who have chose to vaccinate their children. So just look at 2 different populations. Okay, and there have been some past unvax studies, one of them by Tony Mawson at Jackson State University in Mississippi. This was published in 2017 by the Journal of Translational Science, and this was based on homeschool children. Approximately 660 homeschool children were surveyed, their parents were surveyed, and out of that, a substantial portion of the children were unvaccinated, and they saw significant relationships showing higher incidence of things like pneumonia and otitis media, which is ear infections, allergies, and neurodevelopmental disorders in vaccinated children. In general, this study, for the conditions that they studied, vaccinated children were less healthy than unvaccinated children. And also, if you look at some of the previous studies, an Institute of Medicine report in 2001, this is the prestigious Institute of Medicine, which is now called the National Academies of Medicine, showed a relationship between multiple vaccinations and sudden unexpected death in infants, as well as type 1 diabetes. So there was a relationship. When they looked at vaccinated children, they saw more sudden unexpected death, and they also saw more type 1 diabetes. And then there was a further Institute of Medicine report about 10 years later in 2011, where out of 158 different types of vaccine adverse events, evidence was insufficient to judge a relationship in 135 such events. So out of these events, only 23, they were definitively able to say, was there a relationship between vaccines and the disorder, or was there not a relationship with the vaccines and the disorder? So for 135 of those events, there was not enough data, there was not enough information. So there's a huge need to look at health effects for children who are receiving vaccines and compare those to their unvaccinated colleagues. Now, I have worked with Children's Health Defense since about July of 2019. We did a series of PowerPoint presentations, and we have found 46 such vaccinated versus unvaccinated studies, children and adults, things from the flu vaccine to thimerosal-containing vaccines to the DTaP vaccine to live virus vaccines. And the results are compiled. I put a hyperlink here, and I'm hoping that there are handouts. I did provide handouts for this presentation where you can directly just copy this link and you can get all of the vax versus unvax presentations. In 2018, I was approached by a group of pediatricians called the Pediatric Health Outcomes Initiative, or the PHOI. This is a collaboration between physicians and scientists to investigate just what we're talking about today, the relationship between vaccination and health outcomes in children. PHOI is conducting a prospective study. They're actually recruiting patients for this study right now, and it will be an 18-year study to look at not only whether a child is vaccinated, but what vaccines the child is given and at what age. And they're also looking at retrospective studies like the study that I'm presenting here today. And this is directly using chart data from participating medical practices. The thing that PHOI gave me as an opportunity was to look at actual medical data. What Anthony Mawson did back in 2017 was wonderful, but it was based on parental survey. This is one step further where we can actually look at medical diagnoses. We can look at how many vaccines children received, what vaccines they received, and then what were the health outcomes. The data were comprised of 3 pediatric practices in the United States, and they are located disparately. It turns out that they are no less than 1,000 miles from one another, so it was a pretty broad swath of the United States. And the patients considered for this study were born between 2005, November 2005 and June of 2015. We started looking at the data at June of 2018, so the youngest children in this study, and some were excluded that were under 3 years of age, but the youngest children that we actually included in this study were 3 years or older. Here's my co-author, Neil Miller. Neil is a medical research journalist with 30 years dedicated to vaccine safety education. He is a non-vaxxer. He did not vaccinate his children. He is a hero of mine, and he has done a lot of work, namely published 5 books regarding vaccine safety and vaccine safety studies. And he has published many scientific papers, namely with Gary Goldman. Now, let's look in this particular study, what conditions did we consider? And up here at the top, At the top left, you can see developmental delays. And what we did is we looked at the actual diagnosis codes. In the medical terminology, these are ICD-9 codes. And don't ask me what ICD stands for. I knew it, and it went right out of my brain as soon as I started the presentation. The ICD was updated just recently, and now we have ICD-10 codes. So I looked at medical records that include ICD-9 and ICD-10. So we would look at the specific code for developmental delay, both ICD-9 and ICD-10, and the description for the code itself was called specific delays in development. Also asthma, which excluded wheezing not otherwise specified, ear infections, and this did not account for the number of ear infections. This was just merely, did the child have an ear infection or did the child not have an ear infection? Okay, gastrointestinal disorders, which was non-infective enteritis or colitis, so this ruled out any type of infectious disease. So if a child had food poisoning or something like that, then we did not count that as a gastrointestinal disorder. And then finally, as a control diagnosis, we wanted to pick something that would reflect perhaps differences in healthcare seeking behavior between families with vaccinated children and families with unvaccinated children. So we picked head injury. We felt that for most head injuries that would involve a pediatric visit, and however, head injury is not associated or is not apparently associated with vaccination. So we use this as our control diagnosis, and if we saw a relationship between vaccination and head injury, then we would know there was some type of problem with our data. We started out with a total of 16,696 patients. And then we excluded any patients that weren't born within these pediatric practices. We wanted to make sure that they were born in the practices so we could look at their vaccination records and we could actually accurately reflect the number of vaccines that they received before age 1. The remaining patients with each practice followed up through June 2018. We had about 4,800 patients. And then if they were younger than 3 years of age, we excluded them, so that excluded another 2,700 patients, and that left roughly 2,000 patients. Okay. Now, because we were using a cutoff age of vaccination, we were only looking at vaccines between 0 and 1 years of age, we wanted to establish a temporal relationship where vaccination came first, and then the disorder came after the vaccination. So we considered vaccines only in the first year of life, and we considered diagnoses only after the first year of life. So we had to exclude diagnoses on a case-by-case basis if they happened prior to the first birthday. So we excluded about 10 of the developmental delays, 6 cases of asthma, lots of ear infections because children get ear infections before the first year of life, or for the first birthday, excuse me. Gastrointestinal disorders, and then some head injuries. And then our analysis then was done separately for each one of these disorders. And so we had a separate number because we excluded the diagnoses that happened. We just excluded the patient altogether if they had a diagnosis before the first year of life. If you looked at our total sample and then our over 3-year-old sample, we ended up with 2,047 patients, roughly half and half boys and girls. Completely unvaccinated by age of 1, about 31%. Vaccinated by age 1, about 70%. And then the first vaccine after the first year of life, out of our unvaccinated group, officially these were considered unvaccinated, but out of this unvaccinated group here, 16% did delay vaccines and did receive a vaccine after the first year of life. We weren't as concerned about that because that would bias you towards a null hypothesis, meaning that the children that we were saying were unvaccinated, some of them were actually vaccinated, and so we did see, if we did see a difference in those, then they would bias us towards not seeing a difference. Okay. About 10% had developmental delays, just under 4% had asthma, 40% had ear infections, just under 6% gastrointestinal disorders, and then about 7% head injuries. Okay. Just looking at the number of vaccines, the mean number of vaccines that we had during the first year of life was 8.9, which is awfully low. The CDC schedule, if you follow the CDC schedule to the law before the first birthday, including the first birthday, then you should receive 21 different needle sticks or 21 different vaccinations. So these were practices that were friendly to non-vaccinators. So even our vaccinated group, in essence, was under-vaccinated. They were not receiving vaccines as much as the CDC schedule, although our maximum number of vaccines was 21. So we did have patients in the sampling that were receiving the CDC schedule, but most were not. The age of vaccine in days, the first vaccine was about 102 days or a little over 3 months of life. Standard deviation 65. And the age as of June 2018, our average age was about 5.6. And years, and that was, we felt good about that. We wanted to have an average age that was high enough that we could reflect some children that were receiving diagnoses of developmental delays that may not be made until later on in life. And we saw the average age of developmental delay diagnosis was 2.1. Average age of asthma diagnosis was 3.2 years. Ear infections, you expect that to be lower because lots of young children get ear infections at 1.4. Gastrointestinal issues 1.8, and then head injuries about 2.8. Okay, so now let's get into the results. We compared vaccinated versus unvaccinated patients. Okay, our statistical model, we used what was called a logistical regression model, and we evaluated each condition studied. There were no covariates because we didn't really have a whole lot of information in terms of the socioeconomic status of each individual patient. Maternal education, maternal age. We didn't have a whole lot of maternal records. About the only thing that we had partial data on was whether some of the babies were born, were low birth weight babies. And we chose, because we had partial data on that, then we chose not to account for that in our model. These data were stratified, and this means that we only did direct comparisons for children that were the same year of birth, that were the same sex or gender, and came out of the same medical practice. Because, year of birth, there would be differences in the actual vaccination schedule depending on how the CDC schedule changed between 2005 and 2015. There are gender effects where you may see more or less developmental delays, more or less other diagnoses. So we did not compare boys directly to girls. We only compared boys to boys and girls to girls. And then differences in diagnostic practices in different medical practitioners' offices. So we only compared within medical practices, not across medical practices. Okay, and like I said, no covariates were used in the data. In the model, due to lack of direct patient demographic data. That's something that we're improving on follow-on studies to this particular studies as we're getting more demographic data. But at this particular juncture, we only looked at the effect of vaccination status on the prevalence of these disorders. And vaccinated patients if they received one vaccine before their first birthday plus 15 days, then they were vaccinated. If they received no vaccines, they were unvaccinated. Okay. If they received a vaccine after 1 year and 15 days of life, and that was their first vaccine, they're still considered unvaccinated. So it was only that first year of life plus 15 days that determined vaccination status. Now on the next slide, you can see the results. And in the results, the things that you really want to focus on are what are called the odds ratios and the p-values. Okay, odds ratios are just the odds that a vaccinated child would be getting this disorder versus an unvaccinated child. And you can see for developmental delays, we're about 2.2. Our p-value, p-value is the probability that you got this result by chance. So you want that p-value to be very low. And in each instance here, for these top 3 disorders, our p-value is very low for developmental delay, asthma, and ear infection. And for asthma, we got a quite dramatic odds ratio of about 4.5. So the odds of having an asthma diagnosis in the vaccinated group was 4.5 times larger than the unvaccinated group. Ear infections about 2.13. Now, we did not see a significant relationship with gastrointestinal disorders. For significance, this p-value has to be 0.05 or lower, and we're at 0.17. And then the good news is we did not see a relationship between vaccines and head injury. That would tell us there was something wrong with our data. So we did not see that relationship, and obviously vaccination is not associated with head injury. For males, we got very similar results. Perhaps more asthma in males where odds ratio jumped up to just below 7. In females, we saw something very similar. Our asthma diagnoses were no longer significant. That's probably because we had so few asthma cases. We only had 4 asthma cases in our unvaccinated portion of our cohort. Okay, and once you start to see numbers that are below 5 in any of these disorders, that's when it's difficult to achieve significance, where if we had more patients, if we had 4,000, if we had 10,000 patients, then we could start to see some of these more rare diagnoses. Okay, we also did what was called a quartile analysis. Neil and I were concerned about the number of vaccines that children were receiving in their first year of life. So we separated them in quartiles based on the lower 25% of the cohort, the next 25% between 25 and 50, 50 and 75, and 75 and 100. Okay. And these quartiles then were compared directly to the unvaccinated portion of the cohort using logistical regression. Now, for developmental delays, if you received just between 1 and 5 vaccines, then there wasn't a significant relationship. But once you receive 6 vaccines and above, and all the significant relationships are bolded here, okay, if you receive 6 or above, then there was a significant relationship. So children that were just receiving a few vaccines before their first year of life, there was not significance with developmental delays. Same with asthma, okay? And we actually saw a peak with asthma when in the quartile where you had 6 to 10 vaccines, and that may be to a healthy user effect. Those children that are not coming up with, are not having adverse events to vaccinations immediately after the vaccine or months after the vaccine, the parents will tend to continue to vaccinate, where children who are coming down with issues around vaccination, the parents may stop vaccinating after 6, 7, 8, 9, 10 vaccines. Okay, ear infections, again, a few vaccines did not cause an effect, but the more vaccines that we saw, then we saw a sort of stable relationship between 2.26 and 2.81 for our odds ratios. And then gastrointestinal disorders, interestingly, we didn't see a significant relationship like we didn't see overall, but the more vaccines these children received, then we saw an increasing relationship at 11 and 12 vaccines and between 13 and 21 vaccines. And then there were no relationships that were observed with head injury again. We also did a temporal analysis. We wanted to see what happened in comparing the children that got a vaccine before 6 months, then got a vaccine before 12 months, a vaccine before 18 months, and then a vaccine before 24 months, all compared to the cohort that didn't receive any vaccines whatsoever. And what we found was that with developmental delays, we saw a steadily increasing odds ratio, okay, that the children that were being vaccinated before 6 months, this was only a small slice of the cohort, and then before 24 months, we saw an increase in odds ratio. In asthma, our odds ratio was sort of all over the map here, but it didn't really matter the timing of the vaccination. If a child was receiving a vaccine before 6 months or before 24 months, they still had very significant odds that they were going to have have a diagnosis of asthma compared to the unvaccinated children. And then for ear infections, sort of a steady relationship around an odds ratio of 2, all were significant. And then interestingly, for gastrointestinal disorders, it was only the children that were receiving vaccines before 6 months of life where we saw a significant relationship. And again, with head injury, no significant relationships. And so we were happy with that. You did see that the odds ratio generally was above 1. That would mean that it wasn't statistically significant, but in general, children that were vaccinated were being seen by pediatricians for head injuries more than children that were unvaccinated. And that just could be due to vaccinated children having more of a tendency to go to see their practitioners, whereas unvaccinated children may be less likely to see their practitioners. We also did a repeat of the main analysis with a higher age cutoff. We want to see if we cut off the cohort instead of 3 years of age, we cut off at 5 years of age. Okay, so our minimum age in this particular analysis was 5 years. And vaccination status was still based on only those vaccines received the first year of life plus 15 days. Okay, now when we do this, all of our relationships except our control diagnosis become significant. Okay, we see highly significant relationships in the first 3 and a significant relationship. It's a little close to 0.05, a little too close for comfort for me, but still it fell within significance. Yet with head injury, we did not see a significant relationship. Again, this odds ratio was above 1 because vaccinated children tend to see their practitioners more. Okay, and just as a summary of the result, so we saw consistent relationships for the first 3 diagnoses: developmental delays, asthma, and ear infections. And then additional relationships for gastrointestinal disorders were seen in the quartile analysis when children received more vaccines, and in the temporal analysis when children received vaccines earlier, as well as in our age 5 and above analysis. Okay. We did see healthy user bias in the quartile analysis for developmental delays in asthma. Again, if a child is being vaccinated and they have no apparent health issues, then the parent is more likely to continue vaccinating. Okay, whereas a child may severely react to a vaccination, say have a high fever or a seizure or an episode where they have to go to the emergency room, they may be more likely to get a developmental delay diagnosis or an asthma diagnosis later, but the parents would be more likely to suspend vaccination. So this again is healthy user bias. As a child is healthy, the parents are going to continue on to vaccinate, so you would see those odds ratios dip even in the highest levels of vaccination. And all relationships except for head injury were significant when patient follow-up age was 5 years or above. Okay. No relationship, good news, was seen for our control diagnosis. And how does this compare with past work? It does affirm the results of Mawson et al. 2017, where vaccination status was tied to neurodevelopmental disorders, ear infections, and allergies. And an association between vaccination and developmental delays, including autism, has been seen in multiple publications. Gallagher et al., this was a paper published by Gallagher and Goodman in 2010. Young et al., which is a publication with Heather Young and Mark and David Geyer in 2008. And then some CDC publications actually show a relationship between thimerosal-containing vaccines and tics, as well as speech and language delay. This is unique because we had medical chart data. Okay, we were able to get actual medical diagnoses. All patients were continuously followed up for a minimum of 3 years from birth. Vaccination status was based on diagnosis codes used in patient records, and healthcare-seeking behavior was accounted for by our control diagnosis head injury. If healthcare-seeking behavior became an issue, where our difference between head injury in our vaccinated versus our unvaccinated group was significant, then we would know that we could not necessarily use this sample in order to get valid results. We did not see that, therefore we stand behind our results. Some of the limitations, because of different coding practices among the 3 pediatricians, it was difficult to discern what vaccine was given when. Okay, we knew a vaccine was given on a certain date, but we didn't know if it was a live virus vaccine, an adjuvanted vaccine, if it was a multivalent vaccine. We didn't know which particular type. We did in 2 of the practices, but with the 3rd having a large portion of patients, then we decided not to account for the difference in type of vaccines. Okay. Covariate data were not available. We didn't have birth weight. We didn't have gestational age, patient and parent demographic data, and so we chose not to include them in our model. Vaccination status was determined only based on those vaccines prior to 1 year of age. I feel like in some ways this was a strength because we were able to establish a temporal relationship, vaccinations first, diagnosis second. I would argue that would be much more difficult if you looked at vaccines later than the 1st year of life. Also, the reason why we did that was that the lion's share of the CDC schedule, 21 vaccines, happens during that 1st year of life. So children are receiving a lot of vaccines, and the most vaccines during that critical developmental period, and so we wanted to reflect that. Okay, small size, obviously we want more and more patients. The more patients we have, the more statistical power we have, the more that we can see rare diagnoses. We didn't see a whole lot of diagnoses of autism in these pediatric practices. In fact, the diagnoses of autism were much, much lower than the national rate of 1 in 54. Also ADD and ADHD and tics. We just didn't see a whole lot of that. Again, I think part of that may be because we were dealing with non-vaccinating and under-vaccinated practices. So you tend to see less of developmental disorders, even belied by our own data, when the children are under or unvaccinated. Okay, so I'm going to get preachy. There's a lot that is not known about the vaccination schedule. So we are looking at the great unknown. The safety of the vaccination schedule, along with individual vaccines, is woefully understudied. And that was the reason that Neil Miller and I embarked upon doing this study, is because we wanted to add a vital piece to the woefully inadequate literature and get the ball rolling so other individuals can get vaccinated versus unvaccinated studies published. Okay. The U.S. Institute of Medicine, like I said before, in 2011 looked at 154 different types of adverse reactions that had been tied with vaccines. And they said, and they had insufficient data to rule out 138 of those reactions. Okay, so they just didn't have enough information to rule out about 90% of the reactions. So we need more information. If you can't rule out a relationship with these reactions, then we're putting people in danger, and we don't know what vaccines cause, and we don't know what vaccines don't cause. Okay, they could not, the CDC says vaccines don't cause autism, vaccines don't cause autism. They even have a website that says vaccines don't cause autism. Not true. Institute of Medicine could not rule out a relationship between the DTaP vaccine and autism. Okay, so, when somebody says that vaccines don't cause autism, point to the 2011 Institute of Medicine report. It says there's not sufficient data to rule out the relationship. Okay. Another report of the Institute of Medicine in 2013 said, and I quote, "No studies have compared the differences in health outcomes that some stakeholders question between entirely unimmunized populations of children and fully immunized children." So there aren't any vax versus unvax studies, except for now there are. Okay, we have Mawson in 2017, we have Hooker and Miller in 2020, and hopefully that's the tip of the iceberg, and more of these studies that have more and more patients and more statistical power will come. We know that vaccine adverse events are not rare. A study commissioned by the CDC by the Harvard Pilgrim Health Group was used to automate the VAERS, that's the Vaccine Adverse Event Reporting System database. This was a study that was commissioned back in 2006. And out of 1.4 million vaccines given, there were 35,570 potentially serious adverse events reported, or the vaccine injury rate was 2.6%. Okay, that's not 1 in a million. That's about 1 in 39. Some estimates, if you reflect the fact that some patients receive more than one vaccine, then some estimates showed adverse events as high as 10% when you looked at individual patients and patients that were receiving more than one vaccine. Okay. Interestingly enough, the CDC refused to move forward with the study. After the study was completed in 2011, the CDC merely stopped answering Harvard Pilgrim's phone calls, and they abandoned all effort to automate the VAERS database. The CDC just simply, they don't want to know this information. They simply don't want to know. Okay? So my take-home messages. In the small-scale study that I did with Neil Miller, we saw relationships between vaccination, developmental delays, asthma, and ear infections. Also, children that received more vaccines or who were vaccinated earlier were diagnosed with gastrointestinal issues. And much more study is needed. You know, this paper was published. The publication is in a journal called Sage Open Medicine, and Sage Open Medicine went out on a limb trying to get this paper published. The journal would come under scrutiny, has come under scrutiny, has come under fire for even publishing this information. But we need much, much more study. My paper alone, and Neil's paper alone, has been downloaded from their website 140,000 times. That's at least 10 times more than the leading next paper from that journal. Okay, it's been downloaded many, many times. People are interested in this research. Okay, and you can get the full paper here. I've got the journal's website. All you have to do is go to the journal's website, click on the most read tab. It is the most read paper right now from that journal, about 10 times over compared to the next paper, which has about 10,000 views. Okay. And that concludes my presentation. I'm forever indebted to Neil Miller from the Institute of Medical and Scientific Inquiry for being my co-author, and Children's Health Defense at children'shealthdefense.org, where I serve as one of their science advisors as well as a board member, and the Pediatric Health Outcomes Initiative. All right, and I thank you. There's my rock star. There's my son. I thank you so much for your attention, and hopefully we've got time to do Q&A live.
Thank you very much.